So when I had COVID, I didn't actually qualify for Paxlovid. That's the antiviral medication made by Pfizer. But you might. And that's why we're talking about it today, guys. This is really important for you to know. There is a pill to treat COVID. Pfizer makes one called Paxlovid. Merck has one. Others may come up with one. These are antivirals. If you think of like Tamiflu, that's an antiviral against the flu. Now, Paxlovid, we're going to focus on that one today. That does not treat the flu. It's not Tamiflu, but the concept is similar, right? Okay. This is an antiviral. It reduces your risk of being hospitalized, of having severe COVID. It's actually really, really important. And you need to know because you may be the only one who knows you have COVID. Your doctor may not know. So you have to call your doctor and request this treatment or others that you may qualify for. Guys, I am Dr. Jen Caudle. Let's talk about this medication and who qualifies for it. First of all, this is not a vaccine. This does not take the place of a vaccine either. By the way, anyone, whether you're unvaccinated or vaccinated, you can get this antiviral. We're focusing on Paxlovid, but of course I want you to get vaccinated against COVID. Now this is the thing, again, it reduces your risk of hospitalization and severe disease, but there are a few criteria. First of all, in order to be able to take this medication, you have to be 12 years of age or older, you have to weigh at least 88 pounds, and you have to have mild to moderate symptoms of COVID. You have to have tested positive on a COVID test, and you need to be able to start the medication within 5 days of your symptoms. The earlier, the better, okay? So if you're out of that window, you're not going to be able to take this medication. A couple of the big requirements, by the way, is that, and something you should know is that the pill, at least for Paxlovid, it's 3 pills twice a day for 5 days or so. So it's 30 pills. But this is the thing. You have to be at high risk for progression to COVID, for high risk for progression from COVID, okay? What does that mean? That means you have to have underlying conditions such as cancer or diabetes or obesity or many other conditions actually fall under this category of being high risk. So you have to have that characteristic as well, okay? Other things to keep in mind about this medication, and again, this medication lowers your risk of getting super sick from COVID. It's really, really, really important. It's an antiviral. The other things you should know is that, look, it can have a number of interactions with other medications. This is a doctor's prescription, so your doctors needs to be on top of that and go through your medications that you're taking, etc. Some side effects that's been reported from this, generally it's well tolerated, but there have been instances of increased blood pressure, muscle aches, diarrhea, altered or impaired taste. Again, just because these can happen doesn't mean it will happen. And remember, the benefit of, honestly, lowering your risk of being hospitalized from COVID is really, really huge. If you have kidney or liver disease, again, if you're on certain medications, your doctor needs to be aware of this because you may or may not qualify for this medication. That's Dr. Schmucker stuff, okay? Not necessarily for you to know, but the biggest thing for you to know, though, I guess, is really that this medication exists, that we have antivirals against COVID, that if you get COVID, mild to moderate symptoms, within 5 days of symptoms, you tested positive, you're high risk of progression, yada, yada, blah, 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 that there's a medication that can keep you healthier, okay? So you know this. Okay, I want you to know this so you can call your doctor and talk to them about it. Last thing, I guess, is it's got an emergency use authorization from the FDA. That's not uncommon these days because that's what a lot of these COVID medications have. But know that this exists. Tell your friends and your family. If you didn't understand how this worked, hopefully this will help. Guys, I'm Dr. Jen Caudle. If you've not liked and followed my page, I invite you to do so. Also, those of you who send stars, I respond to you personally, and thank you so much. Also, consider joining my subscription group, Dr. Jen Superstars. For those of you on YouTube, please subscribe to my channel and click the little bell for updates. Guys, I'll see you soon.